So last time I was talking about the prevention of malaria, and I mentioned that we can prevent malaria by using a insecticide treated nets. So it's not just any net, insecticide treated nets. We can use mosquito repellents that you rub on the exteriors so that if mosquito comes in contact with the skin, the repellent is already on the skin, it will repel the mosquito and prevent the mosquito from staying to bite. We can also use environmental sanitation. Keeping your environment clean is very vital, is important. You know why? Because the pools of water around residential buildings serve as breeding sites for mosquito. So if you can keep the environment clean and reduce the breeding sites for mosquito, automatically you are preventing malaria, because when they don't see where to breed, they won't really colonize the whole place. And some places children even get beaten even when they're in the classroom. Children sustain mosquito bites in the classroom. So you see, that means even the school environment needs to be tidied so that the breeding sites can be destroyed, so that mosquito will not see where to stay and breed. And then another way of preventing malaria is that for pregnant women, for those traveling from non-malaria endemic countries coming down to malaria endemic countries, for sicklers, for HIV patients, there is need for malaria prophylaxis. For a healthy person, we don't talk about malaria prophylaxis. You don't talk about prevention of malaria using drug. For a healthy person, it's not necessary, because you're already building immunity as you're having the bite. It's not every bite that brings the person down to have malaria infection. So, but for those who are living in non-malaria endemic environments or countries, for those who are pregnant because immunity is low, for sickle cell patients, for HIV patients, then these people, there is need to have a discussion with your healthcare provider to ensure that you get adequate prophylaxis. Prophylaxis means prevention using drugs, as the case may be, so that you don't come down with malaria. Because why we are particular about this group of people is that when they come down with malaria, it can be terrible, it can be fatal. So there is need, if you fall into this category of people that I just mentioned, then have this chat with your healthcare provider and try to get yourself adequate prophylaxis so that you prevent yourself from coming down with malaria. But in case a child had come down with malaria and is already severe, please don't attempt to handle it at home. This child has been having fever and now the child is having altered level of consciousness. You are not sure if this child is conscious again or not. This child is having fits. Don't say it's epilepsy. It can still be malaria. Malaria can make children to fit. That is complicated malaria. This child is having anemia. The child is now looking pale. Please take this child to a hospital, because drastic measures need to be taken so that this child can be treated appropriately. Okay, so thank you. That's where I want to drop it for today. Thank you. For in case you're coming across this page for the first time, of course, show that love by clicking that like button, follow this page, share this video, and look out for more interesting topics and Health Matters with Dr. Angie. Thank you for staying tuned today. If you have watched this video to this point, I appreciate it so much. Thank you, and please ensure you share so that others will also get this message passed across. Hi, till next time that I'll see you. This is Dr. Angie saying bye.